Hi everybody, I can see you coming on in, so welcome today to our joint webinar with Immunisation Advisory Centre and the Ministry of Health. So we will give you a few minutes to get, and then we will get underway and get started. So great that you could join us. I can see you rapidly coming through, so that's good. Yeah. So it's about 3 minutes past 5, so we'll just give it a couple of, probably about another sort of 1 minute, and then we will get underway, because I'm aware that many of you have probably been dashing around work and are still at work and are just getting ready to close off. So.
Yeah, so it looks like the numbers are slowing.
Yeah. Okay, well, look, welcome. We're going to make a start, and thanks for joining us. And it's my absolute pleasure tonight to have you all join us for this webinar around looking at our workforce and how we're going forward with the COVID vaccination program. We have Fiona Michel joining us tonight from the Ministry of Health. And Fiona is the Director for Sector Engagement, Workforce and Welfare, and is going to be taking us over some of the overview of where the Ministry is planning with the program and how that planning is rolling out, and particularly in reference to the workforce. We also just have a couple of little housekeeping rules that we will manage. So we have the question and answer button down the bottom of your screen. You can use that to ask us any questions, and you will either get a response back directly to you, or some of the questions we'll say, look, we'll answer them online. So that function is working. You can't talk to us, that function is disabled, but certainly please pop your questions in as we go along, and we'll have time for questions. Now, just to say, if you actually have a specific question about your individual course, or on the LMS, or how things are going in your course, either one of our staff will respond back to you, and they will give you an email address that you can email to, so we can sort your learning management system problem out. We won't try to do that as an audience to, you know, the whole workforce. And just so you know, we will send it back to you, but the email is edcovid@auckland.ac.nz. So we'll get underway and welcome, and we'll pass over to Fiona.
Thanks, Loretta. Everybody can hear me okay? Excellent. All right, well, I'll just share my screen because I've got a couple of slides just to help with the initial part of the presentation. And I've put my email address on the front because equally I'm happy to take any questions after tonight's webinar if anybody does want to email me. So feel free to send me a note after this. So the workforce side of the COVID vaccination program and the Ministry's role specifically in this is, as everybody knows, been a great challenge and a great opportunity. And so in this diagram, we've kind of summarised what do we see the real objective of the COVID vaccination and immunisation workforce objective. So down the left-hand side, the primary point is to eliminate COVID-19, and how we see that playing out in the workforce side is that we have our New Zealand and Pacific populations where we are to some extent supporting the Pacific. In order to deliver COVID vaccinations, we have designed at the ministry end and in conjunction with a range of different partners, different service delivery models, or what we're describing as service delivery models. And this is really, how do we get vaccinations to the people? So A service delivery model might be a large dedicated vaccination site, such as the one we have at Highbrook in Auckland, where we've been doing our MIQ workers and their families, where that can service around about 1,000 vaccinations a day. Or it could be that the service delivery model is set up at a marae, and it specifically caters for the local community that work alongside or live alongside that marae, and setting that kind of precedent up. Or equally, it could be recognising as we go forward that there are people who in the disability sector who live independently but are not geared up to attend a big event and may require somebody to visit them in their homes. And so for each one of these service delivery models, and there are a range of them, we need people with different roles, different teams and different skills to support those different service delivery models. So sometimes somebody will do multiple roles. Sometimes in the bigger sites, we have more defined structured roles in order to make those sites work really well. So the next layer down is we have to have the right training. For every one of these roles and teams that we have, and for the skills that we need to deliver, we need to ensure we've got the right training and the right assurance to ensure that everybody in the event is prepared and safe and doing all the right things that they need to do. And it's certainly a big chunk of the value that we get from the relationship with IMAC is about making sure we've got that training and assurance in the right space. And from that, we then drop out a useful workforce that we can then look to try and ensure is available to DHBs and other providers so that they can roster them onto the vaccination activity. So down the left-hand side, we're kind of building from one thing to the next to get the workforce. What we're also really mindful of is that this is unlikely to be a one-off situation. It's not that everybody in New Zealand gets the chance to have their 2 vaccines and we're done. Chances are we are going to need vaccination support for COVID in the future beyond this year, and that could be a situation where we have booster style vaccines. All of these things are still to be determined, but fundamentally we're aware that this is unlikely to be done and dusted in the year after the first vaccination process has been completed. So we're also recognising that we have the opportunity to create a legacy here. We have the opportunity to ensure we have a stronger, larger vaccination workforce. We have the opportunity to ensure that we have a more diverse vaccination workforce, because certainly the messaging we're getting from New Zealand communities is they want to see their population represented in the vaccinator workforce itself. So up the other side, we've got the idea that once we have a really solid workforce who have got great training and skills, that will allow them to perform different roles in different teams in the future, and it will allow us to, as a health sector, create and sustain different service delivery models to better serve the New Zealand and Pacific population. So it's kind of a yin-yang idea. Let's fix COVID, but in fixing COVID, let's also create a workforce legacy that does good things for the New Zealand health sector in the future. So in the ministry side of this, we have worked with our different partners, and we're really clear about the different roles we're all performing. So I thought I'd show you a little bit about how we're working together on this. So on the ministry side, our main responsibility in this process is to forecast what workforce do we think we're going to need to deliver all these vaccinations by the end of 2021 as has been committed. And then how do we create a new pipeline of workforce so that DHBs and other providers have got a workforce that they can recruit into their teams? So forecasting what we'll need, finding a pipeline of resources that can be appropriately hired to do the work. It's also our responsibility at the ministry to commission the training. So if we're agreeing that training needs to happen and assurance needs to happen, we have to ensure that we're taking responsibility to do that. And we also take responsibility for some elements of workforce commissioning. So we're looking to providers that are not typically in the public sector. So an occupational health provider might be a good example of that, where they are willing to provide a bureau-style labour hire service, if you like, that when a DHB says, oh, gee, I need another 3 people next week because something's changed and I need to get some extras on board, we're also seeing if we can provide that bureau-style service through some national commissioning of providers that can provide extra resource. In the middle, we're working with a lot of workforce partners. IMAC is a great example. Some of these occupational health organisations are a great example. And the partners tend to do things like training, design and delivery for us. In IMAC's case particularly, they're our vaccinator authorisers and ensure that we've got safe and appropriate vaccinators. They help us with change management. So when something's different, they're a wonderful communication channel to really reach out to the people that they're dealing with. And they themselves may be this contingent workforce, this bureau-style workforce that makes themselves available to fill the gaps for us. And then on the right-hand side, the vaccination providers. So in New Zealand, again, that's typically our DHBs, or they are the organisations that DHBs have commissioned. So it could be Māori health providers, and it could be GPs, and it could be community pharmacies and all sorts of other providers over time that are being connected in to deliver our vaccines. And so the vaccination providers themselves, their responsibility is to recruit the workforce that they need to do the work that they've signed up to do, to onboard that resource so they know how to do it in their local context, to roster people on, and to ensure people's health and safety when they're working. So they are very much the employer and working in that kind of context. And then across all of us is an absolute requirement for us to be working in partnership with our equity partners, ensuring that we are co-designing everything we're doing in a way that's really upholding te tiriti, and that it is creating an outcome that will mean that all of our communities in New Zealand feel that they can and engage with vaccination, and that that's something that they want to do. This is not a screen that you're designed to kind of see the specific numbers and get too worried about. This chart changes, on a regular basis. But just to give you a bit of a sense of the depth of planning, we have literally sat there with models and with actual information and said, how many vaccines are we delivering on every single week in every part of New Zealand? How many New Zealanders are going to be part of that process? And we've divided this up, and many of you will know that we have a sequencing framework that says we've done the people who are at the border first, and their whānau come first, and then we've done our frontline health workers. And each one of the DHBs has got the same basic sequencing pathway. They're running at slightly different paces because every community has different numbers of people and they're operating in slightly different ways. But what we have is this really clear information at this end to say, right, this is where things are really stepping up. And you'll see on this chart, even if the numbers aren't too visible to you, that we have been pottering along with relatively small numbers up till now. But by the time we get to July, which is really when the general population is really starting to kick in, and we're doing all of New Zealand, the numbers of vaccinations per day really lifts and increases. And the most interesting thing from a workforce point of view is the green line towards the bottom, which says approximately how many people are we going to need to be vaccinating by the time we get to these lifted places. And so at the bottom, the lines at the bottom show that up till this point, what we have been using is existing DHB workforces. So a lot of staff who normally have a different day job have been redeployed into our vaccination sites. More recently, we've been supplementing that with the Surge database. So the Ministry of Health, you can Google MOH Surge database, and that takes you to a page that's been live for about a year now. And that's an input screen that the ministry set up so that when people have identified that they'd like to help with the COVID program, they can go into there, register their names, tell us a bit about you and what you can do. And then depending on the DHB that you are aligned to based on your input, your information gets sent to them to be contacted as a potential resource to work in one of our programs. We're in the process right now of just going through a cleanse of that database. It has been up and running since lockdown 1. And what we're needing to do is to go back and really be sure we have spoken to everybody who is still available, and to make sure that if we have the ability to work with them, that we're doing so. So there's a bit of a process about to be undertaken to check in with everybody who's on the database to ensure if they haven't yet been contacted, or if their circumstances have changed and they're more available than they thought they would be, that we're really having the opportunity to talk to them about how we might be able to use them in the program. I mentioned that contingent workforce before. The reason it's a bit of a lighter line is because it's a little bit here and there. It's the idea of a bureau service. It's not lots of people in that mix, but being able to use them to supplement. Towards June and July, we're looking to bring in a vaccinator assistant workforce, which is a new workforce that will be trained to be able to administer vaccines in a supervised way. And that's a new type of workforce for us. And we're having to, be very thoughtful about how that training is done. But also the opportunity that brings to take workers who have not perhaps come traditionally through the same channels that you would expect, to be able to say, can we work with a different workforce and still make that very connected, very safe, and we believe we can. And then underneath that, we have our primary care and other non-DHB employed workforces who are working through commissioning with local DHBs. And again, they're coming online from around about now as well. So we can dig right down, and again, the numbers are not important here. They're actually pretty old numbers, these ones, but it's that idea that I want you to understand, that we really model it right down to the individual DHBs, days of the week, months of the year, and say exactly how many people do we think we need in order to be able to deliver to the program that has been committed to. And what we also do is we look really carefully at where can we get our resources from. I mean, clearly our preference is existing regulated workforces for whom vaccination is a core part of their day-to-day job. The problem is there are very few of those people who are sitting at home waiting for a phone call to come and join this group. Most of those people are fully engaged in a normal day job where they're using those skills. And so wherever we can, we're utilising those resources, and they are a core part of the backbone. And you can see from this, about 3,500 of the people we've trained to date come from that core workforce. We also have a range of professions who are considered to have an expanded scope such that they can vaccinate as part of their professional scope. And there's a whole range of organisations from the colleges and regulated sides that have said, we think our roles can vaccinate. And so we have been working on ensuring that they have been added to the approved list of people who can vaccinate. Once that goes through, the Officer of Health, to ensure that we're comfortable with that. So recent roles that have been added to this list are roles like dietitians, optometrists, and speech language therapists, all of whom have recently come on board in this space. We have local providers such as GPs, community pharmacists, Māori and Pacific health providers who have resources that can contribute. We have people who have left the profession for one reason or another, and so they have a lapsed APC. And a lot of the different organisations are providing either a temporary APC or an interim APC. And that depends a little bit on the profession as to how long you can have been out of the profession before you're allowed to come back in. But we're working with nursing at the moment who look willing to extend what had been a more limited time frame to something that will be quite a bit longer. We certainly recognise that, you know, a nurse who has been perhaps in their profession for 30 years, if they've recently come out in the last 5 or 6 years, they're not going to have forgotten what to do, and they need to go through training anyway, so it gives them the chance to refresh. So we're going to welcome people with those sorts of backgrounds and experiences to be part of the team. We work with students, and so we've had a lot of interest, particularly from the pharmacy school, but also from nursing and medical schools. So as long as they're in their final year or fourth year medical, they are also welcome to train and be part of our workforce. And there's an awfully good step in for a lot of those people to do that training and to have that contribute really strongly to their professional development anyway. So there has been definitely interest from students. We're working with a range of occupational health providers, as I mentioned before, to see if they can be a contributor to this process. We have non-regulated workforces, and our non-regulated workforces, and this is the vaccinator assistant I mentioned earlier, they are not online yet. We're not at a point where we're utilising that workforce yet, but the kinds of people that fit into this category, they're people like clinicians who were trained overseas, but their training isn't recognised in New Zealand, so they're not practising in New Zealand. But they certainly have a clinical background, and on that basis, being trained would mean that they could well be a useful resource for us in this process. Or it could be that they're a clinician who has had a lapsed APC in New Zealand, and that lapse is longer than their professional body's prepared to give them an interim. So in this context, we're treating them as non-regulated, and they would need to go through a different type of training program. But again, there are people in that, particularly in retired cases, who would like to be part of this process, and we're looking at them in this column. We're also looking to offer training in some instances to kaiawhina workers, people who are in healthcare assistants and other community health working roles, where they may have a skill set such that they can be extended to train under supervision to do this work. And then we're also talking to people in what we refer to as aligned professions, people like NZDF's medics, who today cannot practice on non-NZDF communities, but they may be able to under certain circumstances. We're working with the ambulance service to see how they might be able to help us. And we're kind of even exploring the idea of, if we really needed to go there, could we train veterinarians to do vaccination? So, you know, no stone is unturned really in terms of what's possible. But what we actually want is to start on that left-hand side and really look to see of our existing workforces and of those people who are in scope, can we pull everything we need out of these groups? And we're building the numbers up in these ways. So as of today, numbers hot off the press, we have a little over 4,000 people who have been trained to vaccinate the COVID vaccine. We have about 1,600 of those people who have been actually vaccinating in a vaccination site so far. And of that, of the overall group, about 10% of that group is Māori. And about 140 of them are again practicing in our vaccination sites now, and about 119 of our Pacific workforce have been trained, and about 35 of them are working in a vaccination site today. So that's a little bit of a summary of everything that kind of gives you a bit of the context around it. But perhaps I'll pause there and go back to Loretta, who I think is going to provide a bit more info, and then we'll be able to take any questions that you have.
Thanks, Fiona. That was great to hear, and really good that we've got those hot off the press slides. that we can see in the numbers that are coming. So now I'm just going to share my screen. Are we all good there, Jenny? Yep.
Looks good. Just need to share slide, start presentation.
Yeah, just mine is still slightly, I think no, I'll just go back down to the slide presentation here. There we go. We all good?
All good.
So, yeah, look, it's great that we've got that overview, Fiona. I think that's really given us a good sort of starting point. So what I'm going to do is go in and look at a few more details around the training itself, and also just give you a quick few stats. I'd just like to say that Fiona's stats are more recent than our stats. We pulled ours on the 4th of May, just so that we could do a little bit of tinkering with them and analysis. So they're very much the same, but yeah, slightly different. So just in saying this to you, I'm just moving my slide itself out. We currently are continuing to train vaccinators every day of the week. And currently, we've now reached over 16,000 in that vaccinator workforce. So the left-hand column of Fiona's spreadsheet table. And that's great, because when we started this exercise and we counted people back in October, we were at approximately 13,500 to 14,000 actual vaccinators. So, and you can see where those are made up. So the green is vaccinators, and that could be authorized vaccinators, provisional vaccinators, or pharmacist vaccinators. Fiona talked about the 100 Defence Force medics who have all completed training. And we also have 3,800 GPs who are sitting there and are also able to vaccinate. Now, this slide shows you how we've been training the people to deliver the COVID-19 vaccine, Pfizer vaccine. And when we went live with this course in 17th of February, and at that time, the people coming onto the course were coming through the DHBs who were setting up the clinics onto a spreadsheet, into the Ministry of Health, then into a MAC, and then onto the course. So you can see that at that time, we were training about 350 vaccinators per week. So that was about 40 vaccinators a day. Now, on the 29th of April, the course became live and open access. So nobody needs to go through a DHB spreadsheet or into the ministry. They can go straight to the IMAC learning education page. They can click on. And so you'll see that actually since then, we've actually scaled up, and we're doing about 144 per day that are coming on. So that's great. It's about a scale up of 3 times. And we would expect that to continue to grow. We do have other people coming on to our course and learning management system, and this is specifically for COVID immunisation register, and they are admin staff, so they can do a separate course. And again, that started in February and has continued to grow. It is a smaller number, but these are just administrators working on the COVID immunisation register. But also to note that everybody who does the COVID training course as a vaccinator does do a COVID immunisation register module, and you do need that so that you can be on the COVID immunisation register if you're having to input any vaccinations that you've given. So remembering, if you look at this number, then if you add to it the total number who have trained. So we're sort of at that sort of about 5,000-ish mark, 4,000 to 5,000 at the moment. We just did a little bit of a breakdown, and this is good as, you know, for us as well as we're looking, because we need to start thinking now along what Fiona has actually presented in terms of the workforce and what we're going to need and where we're going to need them. So we just broke it down into the 4 regions just to have a look. No competitions here because, of course, we know the population and also the rollout. But it is good to see that we, are making progress, and the southern DHBs and northern DHBs have, of course, had their programs underway a little bit longer, and so those are larger numbers there. But there's a little bit there that we need to go in and do some data cleansing, because there's about 250 people there who ticked the box saying they didn't know what DHB they were with. So we will do a little bit more of that. But this system we have does allow us to, just to be able to have a look and see where the workforces are. And, if we come to that place of needing more workforces in a certain area, we can sort of narrow that down and pinpoint it a little bit. We do ask ethnicity profile in all of our learning management systems. And it isn't compulsory. You can actually leave that vacant. So at the moment, of our total number, we've got about 240 people who chose not to answer that question. But it does give us a good profile of the number coming through. Of course, we want from our communities, we want people to be able to feel like they are being immunised from people that they are feeling comfortable and familiar with from their communities. Our data that we take for this is standard as per the New Zealand stats data. So if a person actually does put Māori and then another ethnicity in, then it's automatically taken as Māori, and the same thing for Pacific. So I just thought I'd give you a little bit of a look. Most of you may well be familiar with this, but just some of the education that's available and some of the training pathways. So certainly we're working very closely with the Ministry of Health team and supporting, both the program, but also our healthcare workforce. So we have been in development of a lot of education content and training materials, have some great people. We have Jane Morford on in the background with us today. Jane and team have been doing a great job. You can imagine at the beginning, as we started this, timeframes were short, but also we've had to adjust and change content. And some of you out there probably are aware that we started off one way of drawing up the vaccine and we needed to change that. So there's a lot of work that goes on in that development phase. Then we have the delivery of the education, training and resources. And that's multiple ways that we are delivering at the moment. Yes, some of it is around the COVID actual courses, but there's a number of communications channels. There's a number of staff out in field who are delivering. There's train the trainer. There's presentations to different health professional groups. So that's part of the delivery. And then also looking closer at some of those resources and comm strategies. So some of you may have noticed that when you go to immune.org.nz now, we have a new COVID website. So you can click on a button and it takes you through. And there's a lot more targeted resources that are there. This is just a little tiny part of the team, a few photos up there. Overseeing and working, and we have our COVID regional immunisation advisors. So we have those across the 4 regions as we do traditionally with our regional advisors. Lisa Box in the Northern region, Olivia in the Midland region, Melanie Miller in the Central region, and Sue Rogers looking after the South Island. And then we do have 20 COVID immunisation education facilitators. They are spread amongst the DHBs in different amounts of FTEs, but they are there working really closely with the DHBs and also with the sort of broader, it could be PHO, the planning, it could be around simulation. They're amongst their supporting immunisation coordinators. Lots of jobs going on with those people at the moment. And we have 5 medical advisors. So we have our 0800 line running extended hours now. And if our nurse advisors are not able to answer the question, we have medical advisors on every day, and then we can pass the call through to them. And behind all of this team, there is a program of support people. We have Jenny Wong, who's our project manager at the moment, and there's a number of support other services. We have a Māori engagement advisor, and we have Pacific engagement advisor, and then we have some comms alongside that as well, plus information manager. So again, just to become a COVID-19 vaccinator, so if you're not familiar, as Fiona's pointed out, there's a large number of people in scope of practice who can do the training now. If you are coming through that way, you would be doing the Provisional Vaccinator course. If not, you would be doing the Authorized course, so the Authorized Vaccinator. And then you have to go on and you do need to do a separate module. And then from that, you will have a certificate to say that you are able to give COVID vaccines. So, and just to remember that if you have done the Provisional Vaccinator course, the certificates are valid until June 2022. And under that provisional authorization, you are able to give influenza vaccine and MMR. And then when you do the COVID module, you can also include the COVID vaccine. So on our website, there's a number of courses that you can see and choose. All of the courses and training are free. And you'll see that there is a COVID-19 vaccination for prescriber health course. That is a course that is there for anybody who has prescribing rights. So that's GPs going in through there, midwives going in through there, nurse practitioners going through there. So all of the courses, when you go in, there'll just be a few little check-in questions, making sure that you have got to the right course. And just some of the things there in terms of the prerequisites. So to do the COVID course, you do need to have either an authorized or provisional authorization. If it's pharmacists, including interns, and then the people who have got the prescribing rights. And you can just sort of see a little outline of the course content there. It's very succinct with the content, and depending on how you like to learn, there's sort of options, including the COVID immunisation register. If you're doing both that module and the COVID vaccine, it's probably going to take you about sort of 4 hours. If you're sort of looking at more detail, there's lots of options to choose more information. You might choose to take a little bit more time if you're pretty familiar and are making your way through at a sort of greater speed. It might take you sort of somewhere around that sort of 2 to 3 hour mark. We do on our new website have some other information. So there's an introductory guide to the COVID vaccine, and that's a free course. Anybody can do it. You don't actually have to sign up or have a login for the learning management system. So if you've got, health in your workforce place, you've got staff who are working, perhaps practice managers, receptionists, other healthcare assistant staff. This is a great course. It gives you all of the basics around, just what the vaccine program is in New Zealand, and then a little bit more information specific to the vaccine itself and how it works. There's no assessment or any part of that. It's just like a tour to give you a good outline of our COVID vaccination program in New Zealand. And as Fiona said, we are looking at some extended workforces and have been working alongside the Ministry of Health in developing some courses to further assist. So the idea is that, if we can have other people in particularly the mass vaccination clinics to support other parts of the vaccination program, then the trained, vaccinators can be working at the top of their scope and concentrating on that. So we are just starting getting this ready. We've piloted little pieces of it. Hopefully it'll be up in sort of the next 2 weeks, 2 to 3 weeks. But some of the things is everybody would get a little bit of an introduction to immunisation and how immunisation works, some information around the COVID vaccines and having a conversation. And we can also train for the cold chain management and also post-vaccination observation and care. And of course, also thinking about the module that I talked to you before, where we have lots of admin people looking after the COVID immunisation register. So that's something that many of the DHBs are keen to see supporting their program going forward. Just to say that if you go on to our website, there is lots of training, there's updated information all of the time, different materials that can be read, so that's there. We, as I said, have the 0800 number for our health professionals to call if they're needing any information. And just a reminder also on our website, if you haven't subscribed to the newsletter, good to do that, because that way you will get direct information to you if anything is suddenly changing, or information that we are bringing up and sharing, or webinars that are coming on, etc. So that is where we have got to, and I will stop and share. And Jane is looking after the questions. So welcome, Jane.
Hi.
So please feel welcome to pop your questions in. Now, I'd just like to say to you, if you sent a question in through our IMS Comms channel that was associated to this webinar, somebody will email you back, but please feel welcome to also just type your question in the question and answer if you would like that question answered tonight, and we will make sure that we do that. So Jane, how are the questions there?
Right, well, we've only got a few, so I haven't replied to them. I've let you do them live. So what's the processing time for provisional vaccinator applications? And can the COVID vaccinator online training still be done if we're waiting for the provisional authorization letter?
So yes, so the time at the moment, there's a little bit of variety. If your employer puts you through as an urgent, because we do take urgent ones, particularly if the person is, about to start vaccinating tomorrow or the next day, and usually they will let us know that they would normally be done within the day. Other than that, usually sort of 2 days, max 3. If I could just point out, most of the hold-ups on the processing of these is that the forms are not filled correctly and the associated paperwork isn't attached. So when you're doing it, and particularly also if you are on here as an employer, can you please talk to people and maybe even just have a visual check with them that they have actually filled out the criteria, because otherwise it has to get sent back to them, and then that takes time. And yes, we do have a way that if you're waiting, you'll be able to do that COVID course as well. So we've got that available. Yeah, if you did have a problem, then also feel welcome to email. And then again, we can quickly pull you up in an email and find you, and someone will call you back and try to resolve your problem.
Okay, so that's just checking we've answered all of that. Yep. So there's another one here, like to ask about peer assessments, and this is one that we get quite a bit. Struggling to get a peer assessment done at the moment. Unfortunately, haven't been able to link in with the immunisation coordinator's help with somebody. So
we do realise that has been one of our probably bigger challenges and barriers. Now, I'm not sure what DHB you're in, but you could also use that email address that I gave you, the edcovid@auckland.ac.nz, because we could get you in touch with somebody. So we have got our COVID immunisation facilitators out there. We now have all of them working with providers, with people looking for peer assessments. And we also, so we'll either link you up with somebody where we can get you in to do a peer assessment. So that could be at the moment an influenza clinic. It could be a COVID clinic. If we can't do that for you, we have now a simulation program going where you will come in, you will meet in a simulation clinic, and we will take you through the process. You will complete your peer assessment as a simulated peer assessment. And then when you go into the workplace, you'll just make sure that, you work along somebody, for the first 5 or 10 immunisations so that you feel confident. So if you are having a problem, please do email, because we do have staff out there that we can link you with.
Right. And now this is a more general question about the rollout. So why were trained and experienced...
Still there, Jane?
Oh, right, try again. Is that better?
Yeah, I think you're freezing a wee bit.
Oh, it's probably my internet. Yeah. Try again. So why were trained and experienced vaccinating pharmacists not given the opportunity first rather than big expensive vaccination centres?
I'm happy to take that one if you like.
Yeah, I thought you might.
So most people will know we have a sequencing framework that required that we were working with border workers first and so on. And there's a whole combination of issues as to why it was more practical to bring some of those groups together in sites close to their workplaces and in a way that we could manage the logistics, because this vaccine requires careful handling. And we have had to learn a lot in this first few months of putting it in place. So in order to get the vaccines in the right places at the right times in a way that we don't waste it, working with bigger groups alongside their employers were the easier way to manage these first phases of the deployment. As we start to move more into general population, and the population will have views on who they want to vaccinate them, at that point in time, we're more likely to be working more closely with a wider range of providers, and that's what the DHBs are doing right now, is they're making arrangements and commissioning groups within their regions.
Thank you. So this one's probably one for Loretta to answer. There was something in the media hinting that the vaccine doesn't need to be kept at such cold temperatures, but can be in a normal fridge for a couple of weeks. Is this true?
So there is something in the media. So we have already had Pfizer doing lots of studies at the moment on the stability of the vaccine. So we were at -70 freezers, then we were at -20 freezers for 2 weeks. There is some ongoing studies looking at, could it be stable at a normal vaccine 2 to 8 degrees. It hasn't been finalised at all. It's a process that they're undertaking. So certainly not at the moment. And they will need to continue to do studies on that. But, you know, if it eventuates, that could be a very useful thing.
And just for anyone that's maybe listening in that hasn't done the training, you do actually get 5 days of normal fridge storage once the vaccine's been defrosted. So there is already some capacity to use normal cold chain as well. Right. So there's just another one here asking about the processing time for non-urgent applications. And you said that would usually be about 2 to 3 days.
2 to 3 days at the most, but please make sure I know from the people doing this work, I would say probably 30% of forms at the moment are coming in and they've forgotten to attach part, or they haven't filled the box, or they haven't, you know, got somebody to sign to say their peer assessment. So please take great care with your form, because it will be much quicker if it comes in and all boxes can just be checked off.
Yeah. And just to clarify, I think you've already started answering this one, but if somebody's done the provisional course, they're waiting for their certificate to come through, can they go on and do the COVID course? And yes, you can tick the box on that to say that you have completed. You don't have to have your provisional certificate in your hand. You can just tick that you have completed the provisional course. And then obviously you need to ensure that you get your provisional vaccinator certificate to go alongside your COVID certificate before you start working. So that you won't get that until you've submitted all the paperwork, but you can do the next stage of the training. So that one's answered live. We're getting there. The email address for peer assessments, was it EdCovid? It's actually Reg, isn't it? Registration.
The peer assessments you could send through to the EdCovid because someone will pick it up. The other one, the IMAC Reg, is just for the provisional vaccinator registration process. So it's ED.
Oh, right, I'm with you. Yes, yeah, sorry. Yeah.
edcovid@auckland.ac.nz.
That's if you're struggling to get yourself a peer assessment sorted.
Yeah, because
the other
we
one
can
once
just
you finish the paperwork.
up.
Yep. Yeah. Okay, that makes. So So we've done that one. I think we're getting there. If anybody else has got any more questions, type them in quick. So thanks for answering the questions about processing time. We've done that one.
We're doing well. We've got 8 minutes left. We usually try to make the webinars sort of within the hour. So we're doing good.
We've answered that one. I think we're, and just can we repeat the email addresses again, please?
So ED COVID, all one word, EDCOVID at auckland.ac.nz.
Right, and there's no more questions at the moment.
So thank you, Jane. And Fiona, thank you so much for joining us tonight. It's great. I think you're the first ministry person who's joined us on one of these webinars. So really appreciate you joining us in, and thanks to all the people behind the scenes. If for some reason you didn't get your question in, certainly pop it through to that email address, or actually if you go to our website, you can email us at any time just by clicking on the contact us, and we will get that. So yeah, thanks to the people who have helped, and really appreciate you joining us tonight. Thanks then. Ka kite.
Yep, you're just typing that in again. So
okay, we won't close off.
So we don't close off yet. I just sent it through, so they've got it written as well if they want it, the email addresses. And then, yeah, there's no more questions coming through. So, yeah, I'll let you close. So have a good night,
Thanks.
everybody.
Bye-bye.
Bye.